Hello. Hi, everyone. We're just letting everybody join. So nice to see so many faces popping up. We're so happy to have you. Just going to let everybody join right now. Welcome. My name is Rachel Lieberman. We are so happy you've joined us for our, in quotation, brunch with the dietitian. I think we're going to have an amazing conversation today with two of our fantastic dietitians here at the University of Chicago. Before I introduce them, I wanted to just introduce myself. I'm Rachel Lieberman. I'm the executive director here at the Celiac Disease Center. And alongside myself, Lindsay Yakel, who is our educational coordinator, and has done such a tremendous job this month, providing so many opportunities for education. So I just want to remind everyone that we actually have, all of our education from this month, if you weren't able to join us, is on our YouTube channel, and Lindsay will follow up after this session with that link. So you can watch not only today's session, but as well as other sessions throughout this past month. So happy culmination of Celiac Awareness Month. It has been awesome. We've had so many opportunities to connect with so many wonderful people, and we are thrilled to have with us today. And I just want to call out, we also have Dr. Ritu Verma, who is here. She's our medical director with us, and Maria Den, who's one of our amazing nurses here at the Celiac Disease Center. So we are so thrilled to have our team here, but we are really showcased on our two fantastic dietitians. So with us today, we have Audrey Roen, who is one of our pediatric dietitians here at Comer and part of the Celiac Center. And we are so thrilled to have Audrey with us, and Lori Welstead, who is here with us. And she is one of our adult dietitians. And we could not be more excited to have you two. Now, what's fantastic about today, we've gotten a lot of questions on the front end of this, but I want to remind everybody, let's use that Q&A function throughout, and we'll put all of our questions in there, and Lindsay and I will definitely be trying to get to as many as we can. And so without further ado, what I thought might be awesome is if Lori and Audrey, you want to just introduce yourselves and kind of take it over from here and talk a little bit about your role here and working with patients with celiac disease. So Lori, do you want to start?
Okay, sure. So hello, I'm Lori. I've been at University of Chicago for 18 years, which is crazy. And I work with adults in an outpatient setting. And so I've been seeing, celiac disease as well as other GI disorders. And so I'm very passionate about celiac disease. And we do a lot of patient education as well as provider education. I also was diagnosed on a side note with celiac disease in 2015, and that was after working at U of C for 11 years. So it was kind of a shocker to myself. So it definitely has made me a better dietitian, to have more empathy and to really understand really living with the disease, right? I'm happy to answer questions today, and I'm sure there are a lot of things that you might hear that's misinformation. So our goal is to really kind of slay that misinformation, give you more variety of foods that you could eat versus feeling like you can only eat, a very small amount. So that's my goal, is, more variety, eating all the colors of the rainbow, and quality of life. So nice to meet everyone. Thank you.
Amazing. So Audrey, please introduce yourself.
Good morning, everyone. I'm Audrey Roen. I'm a pediatric dietitian at the University of Chicago. I work with Dr. Ritu Verma in the Celiac Disease Center, and I also work with the pediatric residents on Fridays at Comer Clinic. We do our Peds GI Fellows Clinic, so I'm working with, just like Lori, a lot of different GI disorders, a lot of, and specifically celiac disease. Very passionate about it, very, like Lori said, eager to slay the misinformation, just like a fruit ninja, if only that were a thing in real life. But I'm so happy that you're all here to join us today. We'd love to answer all your questions about all things celiac disease and everything that comes along with it, right? Because it's like celiac disease and constipation, celiac disease and nausea, celiac disease and we're here for your ifs, ands, and buts. And, I hope that your coffee is strong as you join us today and on our brunch with the dietitians.
Amazing. Awesome. Well, Lindsay, if you don't mind, I would love to start this, and then I'm going to let you get to some of the questions that have been submitted. But right away, we have an awesome question, cross-contamination. It's a huge topic for us when we are managing our celiac in our own homes and also outside of our home. And so I would love if you both could try to address, cross-contamination. Are some people more affected than others? And any tips or insights you have to that specifically?
Okay, yes, that's there's so much to go. That could be like a half-hour conversation. So I'll start with certainly some people might seem to be more exquisitely sensitive, and they might have overt symptoms if they get cross-contaminated. And in a way, that's kind of a beneficial thing because they'll know if they're gluten, whereas others might get cross contact and have zero symptoms whatsoever, right? And so, in either situation, it could be a challenge, right? Because some people don't know if they're getting cross contact because of their situation. So we still do recommend to be mindful of the overall cross contact situation. I'll go into some of the different things as well, but yes, regardless of your symptoms, if you get them or not, you still want to be aware of cross contact. Now, again, it's drawing that fine line of kind of like walking a tightrope to say, okay, you know what? You want to have a quality of life. You still want to be able to eat out. You need to speak your needs, right? And I think a big thing is, just kind of like the small things in the kitchen. If you're in a shared kitchen in your household, just being aware of some of the things that could be highly cross contact. So I'd probably say, condiments. So if someone's just putting a knife into a bucket of mayo and putting it on regular bread, if you had a black light, that mayo container could be full of gluten, right? So being aware of things you put a knife, a spoon, a fork in your own kitchen. So for myself, I live in a shared kitchen. And I'm very aware of it. At times it could cause some anxiety about certain things, right? But I have my little system. So I have my own nut butter compared to what my kids eat, right? Just to kind of keep my sanity. So I'm not going to cross contact, but I have a stick of butter that we all use. I just take one little thing off at a time. So it's not like you have to get every single thing new and separate and whatnot. We oftentimes recommend using a squeezy container. So if you think about things like mayo now comes in a squeeze container, mustard, ketchup, if you have fancy mustards that are in small jars, sure, those could be full of gluten if the whole family's using it for sandwiches. So nowadays, even fancy mustards come in squeeze containers. So that would probably be a big one. And then just being mindful of, if someone's baking bread and things like that in the house, just being aware of not just taking your toast and just throwing it on the counter, right? Using a plate or using those kind of things to kind of watch that cross contact. Now, in regard to that, like I said, this could be a 10-minute conversation here, is that, if someone is baking things with gluten, certainly it could be airborne, but we need to learn more information about airborne gluten and how long it lasts. There was a small study out of Seattle, and they used a KitchenAid mixer and they put gluten in there, and it depends on the amount of gluten that's in there and then the distance. So bottom line is, you could have a shared kitchen. If if someone's baking a lot of bread with regular gluten, just being aware that it could be in the air on the contents of things for a couple hours, right? So wiping things down. I have some patients that are so worried they sometimes use a mask if they're going to be baking some with gluten with their family, right? And again, it's one of those things of finding that balance. For myself, I bake stuff at home that's all gluten-free. So it's gluten-free cupcakes, they taste the same. I have different things like that. And then the kids have their own loaf of bread or things that are already gluten that's already baked and ready to go, right? Or they might eat gluten at my parents' house. Now, as far as eating out, I do recommend, checking out, find me gluten-free, looking online, seeing if the place has a gluten-free option or menu, if the menu has gluten-free labeled, right? You could call ahead, things like that. And then for you, really being the advocate, if I do eat out with my friends, they kind of know now after like the 8 years or whatnot, like, Lori, where do you want to go? Right. And so it's like, oh, this place I know has a gluten-free menu. Or also if the place doesn't have a gluten-free menu, what could you do that's going to be more of naked, right? So say if you did something like grits. Grits are naturally gluten-free, right? That's going to be less cross contact maybe than, I don't know, getting a gluten-free piece of toast at a place that you're not quite sure how they're preparing it. So like I said, I could talk for probably 20 more minutes about cross contact. It's something that it doesn't matter about your symptoms or not. You still want to be overall mindful of it. And it's more of that consistent gluten contamination that we're worried about, right? If you're getting if you got gluten when you're eating out once in a while, that's not a big deal. If you're consistently getting sick or not even getting sick, but your numbers aren't coming down, then you kind of want to go over things with a fine tooth comb just to see where the gluten might be getting in. So sorry for the rant,
Yeah,
but
no.
I don't know if Audrey has anything.
It's amazing. I was just going to say, Audrey, do you have anything to add, or we can absolutely also move on?
I feel like, Lori, you condensed that into like the most perfect 10, not even like 5-minute spiel. Like because you're absolutely right. Like cross contact is so different for everyone. And when it comes to kids specifically, cross contact for us, we usually see it, at least the questions a lot of the time come from, well, what happens when they eat or they go somewhere outside of the house? So kind of like Lori was saying with the restaurants, it's really important to, obviously that's a really big, risk for cross contact. And so like Lori said, it's really important to consider not to continue going out, right? To continue enjoying your favorite places, but just trying to make sure that the protocol that they're following is in line with sort of your needs and not being shy about asking for what you need. Because I'll tell you, these restaurants want your money. They want you to come back. They want you to tell people about it, about the great experience that you had, so that you'll come back and bring your friends. So not only with that, but with cross contact in general, I do not have celiac disease. So I am learning from literally probably the greatest people on earth who could be teaching me this. But so much of what I'm learning about cross contact in the kitchen comes from a matter of management of the logistics, right? Where is the wheat going? Who is touching the gluten? Where is the gluten being stored? Could it be falling into it? So these are sort of big picture questions, or I should say more like nitty gritty questions that will fit into your bigger picture over time. And as Lori said, accidents happen, but in general, if your kiddos are having, and furthermore to the point, your kiddos they tend to be young, they tend to be maybe on the more impulsive side. So how do you sort of manage their curiosity and sort of encourage them to look at other foods, but maybe not necessarily touch everything, So a lot of it is kind of figuring out what works best for you and your family, but really boiling it down to logistics of where is the gluten, who is touching it, and what are ways that it could come in contact with your kiddo's food, and how can we minimize that contact in a way that doesn't necessarily disrupt their, quality of life. No one wants a helicopter parent, but
No.
I mean, celiac is given a whole new definition, right?
Thanks, Audrey. That's great. Thank you both. Good answers. We actually have quite a few on the pre-submitted questions that come back to nutrients, vitamins, supplements. How does a person know if they have deficiencies in anything, iron deficiency, or all of those kind of things? There's literally probably almost 10 questions that came in related to those topics. So how do they find out what they might be deficient in? And then of course, what's the process to work through those deficiencies?
I guess I'll start. I would say, certainly with celiac disease, you could have some vitamin and mineral deficiencies. If you're working with either your primary care doctor or your GI doctor, you can get a basic like getting your iron studies done. And so you could just ask them, I'm suspicious I might have some anemia, or maybe my iron levels are low. It's a very basic blood test. They would test like your iron studies. There's also a thing called ferritin, which is kind of your storage of iron. So that could be something. A vitamin D, certainly patients could be at risk for, even if you have osteopenia, osteoporosis, if in the Chicagoland area, it's very common because of where we are in the world, right? So another test, again, vitamin D, we can check for vitamin D. And then again, I wouldn't say just to go start taking a whole bag of supplements of every single thing out there. I would say first test yourself for the big ones like iron, your vitamin D, just to see if that is in the gutter. You can easily replete that, and that can help you feel better in so many different ways. B12 could be low in some patients, again, for that kind of passive malabsorption. So if someone has sometimes looser stools or fatigue, numbness and tingling in their fingers, I'll ask our GI doctors to test their vitamin B12 just to see if that is low. So, but overall, sometimes even for the first year, we'll sometimes recommend, it's not standard, but we sometimes will recommend taking a multivitamin for patients when they're starting to try to get a hold of the gluten-free diet and they might not be eating a completely balanced diet. That kind of can help to fill in the gaps. But I wouldn't go out and get like a boatload of every kind of supplement out there. But those are kind of the main ones. And again, you can talk to your primary care doctor if you want to see also a registered dietitian. That could be, again, another helpful ally, because sometimes the physicians might forget, or they're looking at so many other different things, they might forget to check your B12 or your vitamin D, some of the simple things, right? So sometimes getting that nudge to say, hey, let's check these levels, make sure they're all good. Because really, once you do go gluten-free, most of your vitamin and minerals that were previously deficient should be normalized, right? Our cholesterol goes up, people gain weight, your vitamins and minerals are normalized, but sometimes they don't. And so I think it is good just to be aware of that. And, you have to be your own advocate as a patient too. So, just speaking up and seeing, again, sometimes those could be overlooked. So, yeah, I don't know, Audrey, if you have any.
Yeah, I mean, I was just going to say, the more you have to cut out or reduce, the more likely you are to run into deficiencies down the road. So like Lori said, I mean, everybody's at a very different stage of healing. Your gut could be, bouncing right back to normal, and everything could just be all hunky-dory, but might not be, depending on the level of damage that you have. So, but I mean, if people do have to eliminate things like dairy in addition to gluten, or if they have to eliminate, different things that make, different disaccharides that make their stomach kind of upset, the more stuff you kind of have to eliminate to prioritize the healing of your gut. That's sort of when we start looking into more vitamin, mineral, oh, I'm purple. Am I purple? I'm purple. Okay.
You're
great.
You're purple. It's fun. I
don't know how I got to be purple, but yeah, and running the risk of, color changes to talk about the Raynaud's phenomenon. I mean, here we are living and breathing.
And Audrey, what I heard from you and Lori, and I want to emphasize to our audience today, is the importance of a follow-up. The reality is that especially when you're dealing with the gluten-free diet and your celiac disease, working with your clinical team, that includes your gastroenterologist, it includes your dietitian, and it is so important. We are here to support you along this path. And I think someone even noted in a question, like, what if things aren't improving? And that's exactly why you need your serology regularly. You need the follow-ups regularly so that you can work with your clinical team to identify if there are nutritional deficiencies and how do you supplement within your diet and or supplements to meet the needs of your body as you're continuing to heal and manage your celiac disease. And I know sometimes puberty plays a role when we're talking about our pediatric audience. Things can change. So it's just, that's why we always emphasize here at the Celiac Center how important it is to work with your team that includes your primary care physician, your gastroenterologist, your dietitian, so that you work as a team to make sure you are in optimal health. So Lindsay, I'll turn it back over to you for another question.
Sure. Another one that we received a lot in sort of different forms, but I'm going to kind of combine them together here, is people are looking for snack ideas. And one in particular some maybe protein related snacks for a child that that isn't eating meat really. So some sort of snack ideas in general to meet kind of all the snack ideas, but also if you could pinpoint maybe a couple of snack ideas that are maybe rich in protein without being meat.
Okay. I mean, I would say I'm not sure if the child consumes, if they can handle nuts or nut butters. Also, sunflower seed butter is a great one that's free of all the top allergens for most people who have nut allergies. That could be spread on, whether it's like vegetables or fruit. You could dip your fruit in like a nut butter, and that could be a good kind of like a quickie snack. Now I'm not sure if the child likes like eggs at all, maybe not. I don't know if that's more of a adult kind of thing. So I'm used to adults. Audrey might have other kind of quickie ideas. I do like Enjoy Life makes a lot of different products. Not all of them are very protein related, but they do have it's like a seed and fruit mix, and it might have like dark chocolate chips in there. That's one of my favorites. My children have nut allergies, so that's what I eat if I'm around them instead of eating my nuts. I know chickpea, they make like chickpea nuts now that are flavored in all different kinds, and that's a high in protein as well. If the child could consume dairy, whether it's, my kids love all different kinds of cheese sticks, whether it's string cheese or Gouda cheese or cheddar cheese or things like that. I'm trying to think of other things too, as far as other kind of quickie things. Yogurt. I'm not sure, Audrey, if you have any other quickie snack ideas.
You kind of hit the nail on all the heads. Like I personally love chickpea snacks as a good gluten-free alternative. One of my favorite brands is actually called Hippeas, Hippeas. It's a really good gluten-free, kind of like chickpea Cheetos, if you will. Really easy to stick in your bag. And like Lori said, hard-boiled eggs are always a good option. Again, if your child can and will eat eggs, that's always a good option. Greek yogurt specifically is a little bit higher in protein if your child can handle dairy, and nuts as well. Not to forget as well that if we're looking at protein from like a zinc and B12 and vitamin standpoint, then absolutely yes, we want to include all of those options in the diet. But if it's also a matter of like frequent snacking, like your child isn't really feeling full after a lot of meals, not to forget too that fruit has a lot of fiber in it that will help them feel full. So we always recommend pairing like a fruit with a protein, or like a veggie with a protein, like celery sticks and hummus is a great quick to go snack. Apples and peanut butter is a tried and true excellent snack. Pretzel sticks and nut butter, the list is endless. So pairing as much as you can will really get the most bang for your buck in terms of snacking, and it'll help them feel fuller and get the most nutrition out of that snack.
Yes.
Wonderful. That's helpful. Hopefully that helps the people who are looking for snacks, and also the one that was in particular looking for protein snacks. Somebody else was talking about bone broth, and they're wondering, if that's good for them, the benefits of that. Just if you can speak to bone broth a little bit and if that's helpful.
Yeah, I mean, bone broth does have a variety of vitamins and minerals. I mean, if you think about historically, I don't know if anyone's made bone broth from scratch instead of buying it now, but it takes hours. Like you have to boil bones for like 10 hours, so it's a very like strenuous thing that you're getting all this, out of the bones, right? So if you look at the ones that you could buy conventionally at the store, yes, they're quite high in protein. They do have a variety of vitamin and minerals. They have some sodium, but some of the brands out there actually aren't as high in sodium. So if someone is having, that could be a way to kind of have like a high protein electrolyte kind of a thing, right? So some patients will also use the bone broth to even like cook foods in too, right? So they'll even use a little bone broth to cook vegetables, or adding it to, even like, whatever it might be, to kind of give them a little bit more nutrients. For patients who also have, say, looser stools or diarrhea or are dehydrated, it could be a beneficial thing to add in. But yes, it could be, pricing to add up, but it could be a tool in the toolbox to utilize, especially when someone's not feeling good or dehydrated. and to get some more protein.
So Lori and Audrey, I was just thinking, would it like be helpful if some kids, even as a snack, could you do like almost like a mini meal, like your lentil pasta or beans or something
Yeah.
like that, where even nachos you could make for
Totally.
the kids that have like beans and add in that way too. I was
Yeah.
just,
Definitely.
And have like a mini meal. Yeah.
yeah,
love
I was
that.
thinking
Totally.
of my teenagers who,
Yeah.
you know, love those mini,
Exactly.
you know, mini
Yes,
meals.
like my
And then they
kids
can
eat
get
those
it.
little, like the kind of like the bento box things, and
Yeah.
there's I think 6 little containers in there.
Yeah.
And so I'll put different things, and that actually excites them to be like, oh, I'm going to have a little bit of carrots. Oh, I'm going to have a little of this,
Yes.
right? So, and I do as a dietitian try to get some protein options and things like that in
Yeah.
there. So yeah, I always say like trying to get all the colors of the rainbow, like getting things that give you some satisfaction, right? You know, things that have some fat and things like that that will keep you full, and the fiber.
Yeah. I love it.
Wonderful.
Awesome.
Okay, another one that seems to be pretty common is people who are really feeling like they're following their diet very closely. They're not eating out. They're really not getting cross contact. We're going to go at this assuming cross contact's not an issue, but they're still having some negative experiences, nausea, vomiting, you know, pains, things like that, that they still are experiencing, but have really gone through the diet and their day to day and feel like cross contact is not the issue. What might be causing them issues that sort of seem like they could be gluten, but maybe not? What are your thoughts
Well,
on
and
that?
now is this person already ruled out that their serologies are normal? And
I don't have that kind
okay,
of information, and it's a
okay,
number of different people who are kind of coming at this in the same
yeah,
way. Cross contact doesn't seem to be the issue, but I am having issues.
yeah. So, I mean, I would say number one is to follow up with the GI doctor and or a primary care to get your baseline serologies checked to see, are my antibodies elevated, to basically signal I may be getting some sort of gluten ingestion. So I would say rule that out. You know, a lot of patients do have kind of overlap of IBS or irritable bowel syndrome on top of celiac disease. And again, there are no markers of inflammation with irritable bowel syndrome, but you could have more gas, bloating, abdominal pain, nausea, constipation, diarrhea, all these kind of symptoms that could seem very overt, but it's maybe not exactly from gluten, right? So in these cases, sometimes I'll have patients like, we'll review like a 24-hour recall. What are you eating in the past day? You know, how often are you eating out? Are you having a lot of different things that might cause gas and bloating, right? Or nausea, right? So certain things, you know, so if you think about like high fructose corn syrup, that's in a lot of different foods, and that is highly fermentable, can cause gas and bloating. If someone's eating too much fat, that might cause nausea in some cases, right? So all those kind of different things. So I really try to each patient by patient of like, what are your current symptoms? And like you said, I think this person said there was very minimal cross contact. So it could be, you know, very anxiety provoking when these symptoms keep, you know, occurring and no one can put a finger on it. So I really like to go back to the drawing board and say, okay, what are you eating? What are you drinking? What's your stress? What's your travel? Where are ways that we can kind of improve your symptoms? And again, there are different other things they can check if someone is having nausea, you know, gastric emptying. Some patients, I have a good amount of patients with delayed stomach emptying or gastric emptying, and other kind of things, you know. Certainly I have patients with inflammatory bowel disease and celiac disease. So again, if you are having these symptoms, you know, you could go to your physician, just get checked to make sure there is no inflammation. That would be a colonoscopy or an endoscopy, and things just to kind of rule that out. But oftentimes, honestly, it's a lot of IBS that we're seeing outside of celiac disease or the irritable bowel.
Excellent. Okay, perfect. I have a question here about whether psyllium husk is safe for using in baking. There are gluten-free bakers out there that use psyllium husk. Is that safe?
Yes, that's totally safe. And a lot of brands actually use it now. and it gives that fluffiness to the product. So Char out of Italy, almost all of their products have psyllium husk, and it does impart a good texture to it. So absolutely. And, psyllium husk is what we often recommend to patients if they're having constipation and even diarrhea, because it's a soluble fiber. So absolutely, it could definitely give some more oomph to foods.
We
Okay.
actually have a lot of Char products getting shipped into our office as like samples, and we often hand them out if a patient comes to us having not been here for a while, or if it's like an in-person visit, then we'll usually hand them a gift bag of Char baked goodies. And they have a great food tasting program. So if you ever need, if you're ever just thinking of trying some Char bread, making sure your kiddo likes it before investing all this money into it, then we absolutely understand. And we can certainly set you up with some free samples to get delivered to your home.
Wonderful. Okay, great to know. Some thoughts on General Mills gluten-free Cheerios. Somebody wants to know if they're okay to eat.
Again, it's very controversial, right? So I think, you have to be aware of the fact that, it's stated that it's gluten-free. So some patients can consume those and those numbers don't go up. I think it's all about the frequency of consuming them, the portion sizes. I personally don't recommend them, only because in the past few years, sometimes after going through a patient's diet with a fine tooth comb, if they're consuming that a lot, we oftentimes would take that out, and oftentimes their serologies would go back to normal. And that was sometimes the only thing that could have been getting in. So, again, everybody is different. This is highly controversial, right? And some dietitians recommend it, some don't. So, you have to do what is best for you. You can always check your levels to see how your serologies are looking. But if someone comes back and their numbers are not going down, or their pathology from their biopsy from an endoscopy is not normalized, and someone is consuming a lot of oats, I would definitely, be mindful of that and maybe cut it out.
We recommend usually Magic Spoon cereal or plain Chex. Those are two great gluten-free cereals that kids usually respond to pretty well. But again, it's a discussion you have to have with your doctor. If like Lori said, if that's the one thing that's causing your serologies to increase, it needs to come out. But, if your kiddo just has to have that bowl once a month and everybody agrees that it's for the best, then that's what it is. But it is a risk, and you need to gauge it appropriately.
Good. Thank you. What about, is there a limit that should be put on prepared, processed, prepackaged gluten-free food? It's a very general question, but as dietitians, should people be limiting the amount of prepackaged processed foods?
Well, I think, you have to just be aware of it. You have to give yourself some grace, a lot of different things. Yes, I think, of course, there are some recent studies coming out that show individuals with celiac disease are likely to develop fatty liver disease, right? If they're consuming highly processed, ultra processed foods, excessive amounts. So yes, you have to be aware overall, right? Eating those foods, I always say that rot and go bad. Your fruits, your vegetables, your beans, your nuts, your seeds, all those kind of things overall that can rot and go bad, right? And then yes, I would not say no no processed foods whatsoever, of course, in a perfect world. But some of these foods, anything could be somewhat processed, right? If you're purchasing it. So I just say, of course, if someone's eating 10 pieces of gluten-free bread a day, I would say, let's get some other sources of carbohydrates that have more nutrients in them, right? Because with anything, even when someone's first diagnosed with celiac disease, I was guilty of it. I went and bought, oh my gosh, the most random things I would never, ever eat but I was like, oh my gosh, it's gluten-free. I got to try this. Right. And it was like not even that great. So I think sometimes people have to go through that process of saying, okay, and like for me, certain things I love, and I'm going to treat myself to that. I'm going to have that. But it's like finding that balance because, I think what everyone else could be eating, the whole world is their smorgasbord. For us, we're already so limited. So I think you have to find joy in certain things. And yeah, if someone's trying to lose weight or things like that, you've gained weight unintentionally, your triglycerides are high, your cholesterol is high, your blood sugars are high. Yes, overall, look at those processed foods, but I think they could still be fit in overall. Just again, it's all about portions.
Well,
And
in
not
kids
vilifying
in
the food.
particular, I mean, I will say I come from a background of working with kiddos with limited food acceptance. We would be lucky if they tried a new food, if they even considered being in the same room as a new food. I mean, really, it gets that intense. So if you're looking to expand your kiddo's diet and the only way you're getting any kind of expansion is through processed food, don't feel guilty about that. That's a win. And it should be celebrated. But like Lori said, I mean, the naturally gluten-free foods, the fruits, the vegetables, the seeds, the nuts, it's like, yeah, we would all want to eat those things all the time if we could. But, kids don't follow an agenda in terms of food acceptance, and neither do we. So giving yourself grace is a really, really big part of it. But when it comes to symptoms like constipation or diarrhea, because those gluten-free processed foods are notoriously low in fiber, that's when the risk starts coming in of, okay, how much do we prioritize really looking for them to eat new fruits and vegetables versus, so again, it's a discussion. Talk to us about it.
Great. Okay. So we have some people that are looking for possible ways to relieve some symptoms they might deal with if they inadvertently consume gluten. Maybe they got a little cross contact when they were out to dinner or something like that. Is there something, Audrey, that maybe you know of that might ease those symptoms a little bit, maybe for the kids that are getting some cross contact?
There was, the name is escaping. I have to hand this one over to Lori because I can think of a few, but I don't think they're kids safe. Lori, do you have any ideas?
I mean, honestly, if someone does get glutened, there's really at this time nothing that's really going to take the gluten out of your system. So it's more of just kind of rest. For adults, if someone's having like like for me, I love there's like a peppermint oil capsule I'll sometimes take. And that can help if you have gas, bloating, cramping, abdominal pain. It's more for IBS. But it's more of just like rest, hydrate. And yeah, unfortunately at this time, there's nothing, they're working on different things right now in the pipeline of, say, if you already eat out, you would take this pill. It could help with cross contact, not just eating regular pizza. But for some of my patients, I'll say, okay, whether it's if you're nauseous, ginger tea or ginger candy, ginger chews, peppermint tea, resting, things like that overall. But yeah, unfortunately, people want to take, charcoal and things like that. It's really not indicated. Certainly people could swear by it, but it could also diminish some of your other vitamins and minerals, and actually bind to medications that you're taking. If you take like charcoal all the time, right? If you think you're getting glutened. So yeah, unfortunately, there's really no cure all. It's more of just kind of rest and let your body kind of heal overall and just kind of get it through.
And recognizing your child's cues if they're very young. Some kids do not have the words to process how they're feeling, let alone what's happening inside their body if they don't really understand what, if like a 2-year-old walks up to you and is like, "Mother, I think I ingested gluten," you'll be like, "Oh, wonderful. Okay." We'll start our healing process. But not every kid has that exact vocabulary yet. So looking for changes in behavior, complaints of headaches, bit more diarrhea. I mean, if your kid is open about what happens in the bathroom, great, keep that communication open. If not, no need to pry, but I mean, looking for those other cues that something might be going on if they don't have the words yet is always a good idea. But it's just like Lori said, there really isn't anything. And I mean, there's stuff in the works, but it's not here yet. So rest, relaxation, hydration.
So
Okay.
we, I just want to remind everyone, you guys are doing a beautiful job using our Q&A function. I want to encourage everyone to please put your questions in there. It's easier for Lindsay and I to manage some of those as we continue through, but this has been an amazing discussion. And I think, Lindsay, I'll let you ask another question before I have a few of my own as I'm like peeling through these, but I know
Sure.
you have a whole list.
I sure do. Okay, so the next question would be tofu. Is tofu gluten-free? Is it beneficial for people to eat? Can you talk about tofu a little bit?
Sure. I mean, yes, tofu should be certainly gluten-free. It's, just from soybeans. Now, yes, we don't want people eating soy sauce in the US. It's made from wheat, but whole soy, which is tofu, is fine to eat. And it's a high protein source. It could be flavored with anything to give it some oomph, and tucked into all sorts of different dishes. So absolutely. And again, with tofu, there's like the really soft tofu that looks like mush that I've made different like fake pumpkin pie, like a cream, it looked like a cheesecake. You could do stuff like that with it, the soft kind. Then there's the extra firm, which is what I prefer if I'm going to cook it, and utilize it that way. And sometimes people don't know the difference and they buy the mushy one and they're like, oh my gosh, they don't know what they're getting. So there's a variety of different ways that you could use the tofu. And yeah, it is a good source of protein that could be tucked into things, sometimes even for kids that they don't even realize.
If
So,
you're
but-
ordering, oh, sorry, go ahead.
Oh, no, and I was just wondering, I just want to clarify. So is all tofu not gluten-free? You have to
All tofu is gluten-free. The only tofu that would not be gluten-free would be if it was, say, seasoned or marinated and it
Okay.
stated it had like, say, soy sauce or something. But yeah, if you
Okay.
go to any conventional store, almost all the tofu is going to be gluten-free. It's just going to
Okay.
be like fermented soybeans or soaked soybeans, oil, like salt.
Okay, perfect. So then you just have to be on the lookout though. If it's marinated or something else or flavored, it's probably not gluten-free or you really need to read the
Or
label.
I would just say just exactly like read the
Okay.
labels. Yeah, like some tempehs, which is similar, could be marinated and have gluten, but
No, that's perfect. Sorry, Audrey, go ahead.
No, that's exactly what I was going to say. I was going to say if it's marinated in anything, just be sure to read the label. And there are honestly really great ways to use tofu when it's easy to cook at home. I had a family who made what they called fake eggs. They made tofu, the super scrambled one. They added I think turmeric and cumin and like a little bit of some non-dairy milk and whisked it up and made fake eggs. And the kid loved it. I mean, I had no idea you could do that, but it's a thing. You can also include it in, I know some people who like to add a tablespoon into smoothies if their kids like more of a thick, creamy texture, versus like what protein powder adds, which is more like a chalky texture, more dry. So it truly does depend. And there are great ways to cook it at home in like a coconut sauce that's really yummy, that's also gluten-free. So get creative with it. Yes, we endorse tofu.
Yes.
That's great. Okay, so we have a question about cookware. Can stainless steel cookware be used for gluten-free and gluten-containing items? If you're in a house where you're doing both things, can we make something with gluten in this pan that we also want to use, at a later date for something gluten-free?
Yeah, absolutely. I think you can absolutely use a stainless steel pot or pan or whatever, clean it with hot soap and water. There's no obvious gluten on there, right? Big chunks of gluten or whatnot. So yeah, hot soap and water should be able to remove all the obvious gluten. Now say again, the things I do tell patients to watch out for is if someone has like, an old crusty cast iron pan, right? That you've been making sourdough bread and pancakes with, and cast iron is very hard to clean, right? You don't use oftentimes soap and water like a normal pan. It's kind of like seasoned and all that. So those are things I'd say that you don't want to just flip flop. It's very hard to get a new cast iron, but stainless steel is, yes, you could easily use it for both.
Perfect. Okay. Let's see. Sorry. Oh, so a couple people that want to talk about things that are certified gluten-free, but also have the disclaimer made in a facility that processes wheat. In general, people want to talk about that disclaimer a little bit.
Yeah, no, it's a very confusing one. So I think that when it says it's made in a facility, those are voluntary statements, right? So they're telling you that to kind of cover their butts in a way, because if someone did have a food allergy, right, to say to wheat, and this product is made in a facility where wheat is, they have to, this is a voluntary thing. They don't have to, those are, when it says it's, those are like the may contain statements. I'm sorry, the facility statements, no, I'm sorry, the made in a shared facility, all those are like voluntary statements. The only thing that's by law is the Food Labeling Act, to say if it contains wheat or contains dairy or things like that. So if you pick up a product and it says it's certified gluten-free, it's been tested to make sure that it's under the 20 parts per million. Now, yes, it might say it's made in a shared facility, but again, people don't really realize that a lot of things are made in a shared facility because it's a voluntary statement. So I would not say you need to avoid the foods that are made in a shared facility. So I would still consume some of those different products. Now, again, it's based, it could be very confusing though. I get it when you first look at some of those products. But when it is certified gluten-free, they're looking at the product from all the different stages. If that makes sense.
Yeah, for sure.
You found the topic that boils a dietitian's blood. I mean, if we, I am always so upset whenever there's a label that has an indicator that says certified gluten-free, and the first ingredient on there is like organic rolled oats. It's like, it is not. So it truly does kind of depend, I think, on your kiddo's level of sensitivity. And if you want to, you can call the manufacturer. You can ask them, is this ingredient processed on the same equipment as, say, another line of, or another granola bar or another, what have you. You can absolutely call the manufacturer, because this is information that they should know. And if they don't know, then I would say better be safe than sorry, and talk to us. We can always find you other alternatives that are just as healthy and good tasting.
Yeah. And I think, at least with those products that are certified gluten-free, they are going through some of that rigorous testing. Because again, like I said, you might be buying foods that, aren't even certified gluten-free per se, and it doesn't even tell you that it's made in a facility with wheat, right? Those are all voluntary.
Right,
so
right.
If it is certified gluten-free, that is at least a level of some safety to it.
Right.
Some.
Right? And another question that was in the chat, actually, Lindsay, and I'll just bring it in here because we were talking about, gluten-free flours or gluten-free breads or products. What's beautiful, I can even speak beyond Lori and Audrey, is that grocery stores now are set up so wonderfully that there are typically gluten-free aisles and allergy safe aisles. You'll see, as you said, the good, like there are certain brands that are there, but it from crackers to flours and baking things. And so typically your grocery store, and I would highly encourage you to talk to store managers or go to not a busy time where it's easier to navigate as you're like newly diagnosed, those grocery store shelves. But I do think, aside from being really good at reading labels, which we all have to, train our brains and look for all those keywords, including malt, rye, barley, anything. I think that also grocery stores have made great strides. There's so many different brands. I know someone asked for specific brands, but there are so many. But Lori and Audrey, do you have any specific tips for just navigating the grocery stores specifically?
That's a good question. I mean, each place is different, right? Like sometimes they'll have all the gluten-free stuff in one area. Sometimes it's dispersed throughout the store. You could always ask, like places like Trader Joe's actually have like a list of gluten-free foods. So that sometimes helps like newly diagnosed patients. That would kind of be something. And then, yeah, like I said, it could be kind of mixed in. Sometimes in the frozen section, there might be a whole area of gluten-free things. That's like a few of my places will have certain things I go to that area for. Some stuff might be in the fresh aisle. But yeah, a lot of the big brands now will make, different gluten-free flour blends that have a variety of things. Whereas again, 18 years ago when I started here, if you wanted a gluten-free flour, you had to buy your own xanthan gum, and then you'd mix all your 4 or 5 flours everything on your own. And it was like, about a thing of xanthan is $20. So now almost all these companies will either put the xanthan gum or do different kind of things to give it that oomph, like the psyllium husk that might be in the different flour blends. I know one of my favorites, I love like the King Arthur mixes for a lot of their stuff, like the cake mixes, the cookie mix, like that's one of my favorites. But yeah, there's a lot of different ones, like the cup for cup flour blend, and you name the store, they have different ones nowadays. So
That's about the same for me. Depending on the store, back in the day, they also used to have, sometimes they had dietitians rotate in the store physically. And, we always recommend never trying to go grocery shopping when you're in a hurry, especially if you're kind of new to the label reading celiac world. We always recommend trying to find just an afternoon where you don't have anywhere else to be, where you can kind of take the resources that we've given you and kind of go at it at your own pace. And if there is ever a label that you come across that leaves you feeling very confused, take a picture of it and send it to us. We can work through it with you.
yeah, and this really got me thinking. I'm like, oh, we should almost have like a talk about like label reading, and I could do like because it's very each label could be different and can be confusing. It makes you think. So yeah,
I don't know how you did it, Lori. I don't know how you
If you think about it, when I started here in 2004, that's when they did the Food Labeling Act. So prior to 2004, if you had celiac disease, it didn't even have to tell you what the ingredients were. So I used to call the chicken companies and say, hey, does this have does it have a broth in there that has gluten? I mean, so before 2004, it was kind of ancient as far as like the food labeling.
That's right. I remember that.
Yes.
Okay, so let's see. Here's a question about if you have celiac, but you don't experience any symptoms, do you need to continue to eat gluten-free? We've got a few people who have been diagnosed, but they have no symptoms and want to know if they need to eat gluten-free.
Yes, you do. Yeah. So you have to stay gluten-free. I know, and it is hard, but sometimes the symptoms could be not as overt. It could be, fatigue, depression, anxiety. You could have just like osteopenia. You could have, all sorts of different things, rashes, hair loss, like random things, dental enamel, hypoplasia, all these crazy things that you would not consider to be a GI symptom. So yeah, I mean, we do say, overall you do have to be on a gluten-free diet for that, even if you don't have symptoms.
That's exactly what Dr. Verma says too. I mean, and she's on here, she can explain it as well. But Dr. Verma always says, it's never just as simple as you avoid the gluten and you get all better all of a sudden. It's like when there's a ripple effect that happens when you ingest gluten. So it's not just you get damage to your gut, you increase inflammation in other parts of your body that increases the risk of other autoimmune disorders down the road. So really, we're trying to prevent those other disorders from popping up down the road that will lead you to have to alter your diet in other ways or take another medication. And then you have to, we're reducing that headache literally and metaphorically down the road.
Okay, great. It looks like, Lori, maybe you mentioned some dental issues and that triggers.
Yeah. Yeah. And I mean, that sometimes it's how, patients sometimes are found to have dental issues, and that could be from the malabsorption. So we have actually had dentists that have come and done our preceptorship in the past that have helped to find people with celiac disease. So you could have dental issues. And so that could be something that was kind of overlooked and you didn't realize due to the malabsorption that you could have the dental enamel issues. There's a variety of things. I'm sure Dr. Verma could talk to it more, but that's just one of the many symptoms that you could have of celiac disease that is not really highly talked about.
Yeah. So it almost sounds to me like the people who say they don't have any symptoms could actually have some they're just not even connecting to celiac. Of course, we do know that there are people that don't have any, but there might be a lot that think they don't, that maybe do, and don't even realize it.
Yes. And you don't want to have another autoimmune disease pop up, or again, that risk of cancer. And we always say, once you go gluten-free, the risk of GI cancers goes down to normal. But if you continue to consume gluten just because you don't have any symptoms, you don't want to have that smoldering inflammation throughout your GI system consistently.
Sure. That's great. Okay. Let's see, there's some information people are looking for about brain fog and what's the connection? Why does celiac cause that? Some brain fog conversation going on here.
I know. I think I'm sure Dr. Verma could maybe speak to it more, but I think it's also a variety. It's one of the things that they're starting to pinpoint, and it could be, I think, we're doing a study on brain fog at University of Chicago. It could be something maybe with the gluten crossing the brain barrier or something. If someone's getting, brain fog from that, it could be, vitamin mineral deficiencies, or that could just be one of the manifestations. So I think we need to do a lot more research.
Which again just goes into the reason why it makes so much sense to become involved in research studies and to have follow-ups and to really talk about all your symptoms. And I mean, nothing is too small. There is no such thing as too much information, especially when it comes to GI disorders. So it helps us understand it more, and what works for you may work for someone else, or your symptoms may be the exact same as someone else's and you just have no idea. So always good to share, always good to get involved in clinical trials and studies. If you want more information about different ones we have coming up, be sure to reach out to Rachel Lieberman and Lindsay Eagle for more information.
Thank you. Thank you, Audrey. You gave my plug. I was going to say we would love to share. We have a pediatric and adult brain fog study here at University of Chicago, and happy to talk about that with anyone. We'll definitely share information. So thank you.
Yeah,
I think, Lindsay, you might have one other thing.
I have one more, and this is basically what people are wondering is how can they connect with a dietitian who can help them in this way? And I think some people are finding that their insurance doesn't cover a dietitian. And so what's the best way to find a dietitian? And then also, if you don't have the money to pay, maybe your insurance isn't covering, what can you tell people about those things and how to end up with a dietitian to help them?
Yeah, I mean, I personally always recommend calling your insurance company because I mean, sometimes truly they just don't know until they run the numbers, until they plug it in and they see, yes, there will be a copay, or sometimes you have to go through a few services and realize, oh, oops, we thought it was covered and it's not. I mean, there's just no clear outcome sometimes. But what I found has really helped is if your insurance company has a website and there's a way to find an in-network provider, more than often there's a search under find a provider. That I know Blue Cross Blue Shield has one of those, and you can always just call on the phone and ask. You can have them look up your benefits specifically. And I mean, if not, if you're a patient at the University of Chicago, we as GI dietitians, we do phone calls based on the recommendation of the doctor. If it's something that's just a quick fix, a quick answer. I mean, there are ways to kind of work around it, but my recommendation would be to go to the website, find an in-network provider. That's what I recommend most of the time.
Yeah, I know. And it's hard because there aren't that many. We're slowly growing as GI dietitians. Specifically, a lot of people say they've seen a dietitian that was like a diabetes one and they didn't know anything about celiac disease. So if you can, find a dietitian, a lot of times now there's a lot more of like the telemedicine and the telehealth and those kind of options. We do write letters sometimes to the insurance if it is denied. But it is unfortunate that the insurance sometimes won't cover because this is the only thing. There is no drug. It's just the gluten-free diet. So I have had some luck writing a letter and it would be covered. So hopefully more and more that will be going towards that.
Great. Rachel.
Yes, this was awesome. I cannot thank Lori and Audrey enough for your time. And I loved seeing so many colleagues on here from our Celiac Center here at University of Chicago who had joined us as well. I this will be up on our YouTube channel. And I think the takeaway is this, celiac, it's a journey. And I hope that you surround yourself. We're here at the University of Chicago, but whoever your clinical care team is, it's so important to meet with your dietitian and meet with your gastroenterologist and have yearly serology. And it is never just black and white. And I think that we are hopefully here for you on the journey. I hope you enjoyed learning more. And we will definitely be sending some follow-up materials. And I just appreciate everyone's time. And as we continue to expand our education, we'd love to hear from you and what you would love to hear from us in the future and offerings. But Lori and Audrey, this was awesome. I feel like we could have sessions just on specific things down the road, but this was a really nice way to close out Celiac Awareness Month. And so we thank you for joining us, and we hope you have a wonderful day. So thank you. Thank you.
Thank you all.
Thanks.
Thank you.